Once you've set your quit date, you'll need planning and practice to prepare for that day and patience to be successful. Step 2 in your preparation is to decide how you're going to go about quitting. What methods will you use? There are several to consider. First is whether or not to use a nicotine replacement therapy. Nicotine replacement products will help you fight the physical cravings as you go through nicotine withdrawal. There are 7 types approved by the Federal Drug Administration, or the FDA. Nicotine gum, the transdermal patch, the nicotine inhaler, the nicotine lozenge, the nicotine nasal spray, and 2 medications in pill form.
One of those is called bupropion, or Wellbutrin. It's also known as Zyban. And this is a smoking cessation aid that's actually an antidepressant, and it was kind of by accident that the researchers found that it worked for people who were trying to quit smoking as well. So you can try that. You have to get a prescription from your physician. And the other aid is called Chantix, or varenicline, and it's designed specifically for smoking cessation, and it works on the brain to try to inhibit that pleasure pathway so that smoking is not as rewarding.
Well, that's a lot of choices. How do you know what will work best for you?
I would suggest that people talk to their doctor. Your physician can look at your medical profile, give you advice for quitting smoking, and possibly prescribe medication to help you.
Now, some people will object to using something that puts nicotine in their bodies. Aren't you quitting smoking to get rid of nicotine?
Although many African Americans are concerned, and they say to me, why would I use a nicotine replacement product? Why would I wear a patch? Why would I use a gum? I'm trying to get rid of nicotine. I'm trying to get off nicotine. But these products work, and they provide you with a smaller dose of nicotine than you would get if you were to smoke. And all of these aids work with relatively similar effectiveness, and they double your odds of quitting.
Nowadays, smoking carries such a stigma that some people may be embarrassed to talk to their own doctors about it.
I think it's important that they realize that they should be able to speak to their physician about any health issue, and smoking is related, because there is an opportunity for their physician to be able to help them to quit smoking and to refer them to counseling sessions, group sessions, and even if necessary, prescribe medications that may help cut the cravings.
In addition to nicotine replacement therapies, there are many other methods to help you quit. As Dr. Powell mentioned, counseling is available either as an individual or in a group setting. So which would work best for you?
Part of my work is conducting smoking cessation programs for African Americans and for the community at large. And these include individual and group counseling sessions. And what I find is that African Americans seem to be more drawn to the group and have very high success rates when they complete a group program. So my suggestion would be potentially that would be the best method to try.
But not everyone will have access to a group program in their community or be interested in talking to a professional about quitting. Another method is to use self-help materials. This video is one self-help option to help you quit smoking by giving you the same type of advice you would get if you went in for counseling. But you can find books, pamphlets, and other self-help materials from your local library and from organizations like the Centers for Disease Control, or CDC, and the American Cancer Society. You can also call a quit line.
Every state has a quit line that you can call and get counseling and potentially some sort of nicotine replacement aid to help you quit smoking. And there's also a national quit line number that you can call.
The National Smoking Quit Line is 1-800-QUIT-NOW. The people there are very supportive and can help you find local resources to help you during the quitting process. For the best chance of success, you may want to use a combination of all these methods.
I recommend that you use group counseling or perhaps a self-help set of materials that you find effective, combining that with a smoking cessation aid, a medication, like a nicotine replacement therapy, or perhaps one of the pill forms of medications for quitting smoking.
Now, we talked a bit about some of the methods you can use to help you quit. But quitting successfully involves more than simply countering the physical cravings for nicotine. It also involves changing your behavior and lifestyle.
Nicotine